Thank you all so much for joining our fall community meeting for the Gun Violence Intervention team. For those who have been joining us this past year, we have some exciting updates to share since we last met in June. And for those of you who would like to stay involved and be included on these meetings moving forward, you can visit our project site with the link on the slide or by scanning the QR code and signing up for notifications. And you'll find that towards the bottom of our project page. And as we wait for everyone to join in, you are welcome to introduce yourself in the chat by providing your name and your reason for joining today. For those who are joining on Facebook Live, you're welcome to participate there as well. We'd also encourage you all to share this live stream on your own Facebook pages. And you can find the stream and share it by going to our Department of Health Facebook page. We will put in the chat. We're going to start with a few quick housekeeping items. For those who are just joining, others are introducing themselves in the chat, and I'll introduce myself at this point. So my name is Bella Young, and I'm a health planner with the Department of Health and the program coordinator for our gun violence intervention team. And I'm looking forward to sharing progress updates with you all alongside our group of amazing presenters and to help facilitate plenty of opportunities to hear from you all as well through this meeting. For those who are joining Zoom on your phone or computer, there's three main buttons that you'll want to reference. The first is the Q&A button for you to submit any questions that you have as we go along. There's also the option to submit questions anonymously if you'd like. For those who are tuning in on Facebook Live, you can also submit questions there. We have someone who's keeping an eye on that chat who will forward all questions to the presenters here. You can also send any questions to the coalition with the email address on the screen, which is gun-violence-intervention@aacounty.org. And then the second important button you'll want to look out for is the chat. We're going to launch several polls and discussions throughout this evening's event. And so the chat is where you can submit your ideas and comments. And finally, if you'd like to have subtitles, you'll want to find and start the live transcript button. And with that, we're going to launch the first poll. And this one is just to get a sense of who is in the room and who's on the call. And for those tuning in on Facebook Live, you can also answer these questions there. And I ask Crystal if you can help me launch the first who's in the room poll. Perfect, so that should pop up on your screens. So the first question is, what group or groups are you representing today? Whether you're a community member, you belong to a community organization, a nonprofit, or maybe you work in the county and you can indicate your organization. The second question is, how long have you lived or worked in Anne Arundel County? The third is, in which county region do you live or work in? And then the fourth question is, when you think of types of gun violence, what first comes to mind? And you're welcome to fill out the poll. We'll give you a little bit of time for that, but you can also put your responses in the chat. Great. So we see that many of the individuals on this call are from governments. We have a lot of community members as well, both over and under 25. We have a lot of folks who have been living and working in Anne Arundel County for more than 10 years. So we're happy to have you all on this call and lending your expertise, but we're also happy to have some newer residents. And then a good mix of what region folks are living in, a mix between North, West, South, and East County and Annapolis City. And then in terms of what types of gun violence first comes to mind, a lot of folks, the first thing that comes to mind is crime and mass shootings and homicides, which I think is often what comes to mind in more broad populations. And so we want to take a chance to share a little bit more about some of the other forms of gun violence as well. Thank you all for answering that first poll. We do have an exciting agenda for today's meeting, and I'll ask if each of our presenters could quickly turn their cameras on and wave as I cover your presentation and the agenda. So we're going to start with introductions, where our health officer, Dr. Nilesh Kalyanaraman, will lead us through. We'll move into coalition updates. We'll have a chance to hear from our education and policy work group, who our Fire Chief Wolford will share about. And then Dr. Kelly Anderson will share updates from our environment work group. And then we'll be moving into sharing data updates, including updates from our data work group. We'll hear again from our health officer and myself. And then we have Debbie Stein joining us from Moms Demand Action to share about the Be Smart program. And then we will conclude, Crystal Coldiron and myself will walk through a training workshop on our suicide prevention toolkit. And it will cover the 3 learning targets that you see on the screen. And those who do attend this training workshop will receive a certificate. So we'd encourage you to please be sure to stay on for that workshop. And I will now start by turning it over to our health officer, who will introduce our county's public health approach to gun violence intervention and the role of our gun violence intervention team in these efforts.
Thank you, Bella. It's really good to see all of you this evening. We're talking about gun violence as a public health issue, and we always want to start with understanding what that means. For a long time, we talk a lot about, when we talk about gun violence, we talk about guns, we talk about more or less, and that kind of conversation hasn't really advanced this issue of really decreasing the violence. And when we talk about decreasing violence, there's broad consensus for that, and that came out during the precursor to this, which was our Gun Violence Prevention Task Force that met all through 2019 and into early 2020. There was broad consensus that our goal was to decrease the violence, was to understand it, and use a data-driven approach where we understood what it is that we were looking at, and then use evidence-based practices to address that, to decrease the violence. And we have to do that through engagement with our community, and that's what this meeting is about, and that's what we are going to continue to build on, because this isn't a problem that any one group or any one sector can address on their own. This has to be a collective effort that involves the community, not just to inform what's happening, but also to implement solutions, right? Because these are, at their core, difficult problems to solve, or we would have solved it already. And so, as we've been going through this and approaching this as a public health issue, we're really focused on 3 major areas. 1, the data. So understanding who is affected by gun violence, where it happens, and what is the nature of it. Suicides versus homicides, and then looking at assaults as well. And then looking to our environment and what sort of evidence-based practices and programs we can either implement, expand, grow, support. And then how does education and policy play into that? What types of health education, and we'll talk about all of these, but what types of health education, gun safety education, suicide prevention, a whole range of education. And then what is our policy response as well to decreasing violence? Because at the end of the day, what do we want? We don't want anybody to die or even be injured from gun violence, right? We recognize that there are guns in society. They serve a legitimate purpose. And we want to eliminate that part where people are harmed from them. And so our approach brings together a wide range of interested and engaged community members, agencies, and nonprofits to be able to do this work. Next slide. And with that, I'm going to turn it over to you, Bella.
Perfect. I may need assistance turning my camera back on.
Is a challenge that I struggled with too this afternoon.
But while that's coming along, we're going to move into progress updates. So where we are at with each of those 3 strategic priorities and each of our 3 work groups. And we're going to start with our education and policy work group. So Tricia Wolford is the fire chief for Anne Arundel County and a member of the Education and Policy Work Group. And I'll let Chief Wolford share a little bit more about what that group has been working on.
Thank you, Bella. Yes, hopefully everybody can hear me loud and clear. For our education and policy group, really what it comes down to is prevention. And as Dr. K talked about, if we can eliminate or mitigate a death or an injury or something that creates a mental scar for our young people, for anyone living in the community, prevention is really near and dear to my heart. As a fire chief, prevention is one of the staples of our education and our philosophy. And if we never have to run that emergency or run that horrible medical call, then we are doing the right thing by educating our community members and giving them tools to make different choices in life. So the education and policy group in the beginning really struggled a little bit trying to figure out what our place is, because education and policy are two very powerful concepts. And we really lived in the beginning with it's more important to educate people and empower, and you do that through knowledge and information. And so we started with safe gun storage and preventing gun violence. You know, what is our strategic direction, and where do we really want to go with this? And we did that with input from the community. We did that from policymakers. We did that from educated professionals in this area. You know, what is the concerns? And from the poll in the very beginning, you know, it was everything is a concern: suicide, unintentional deaths, mass shootings, all of those things are a concern. And so what we wanted to do is make sure that we're creating resources for the public to be able to use to educate themselves. So Bella, if we can go to the next slide. There we go. So resource toolkits, and I'm so excited for anybody that's going to stay on and get some of the training for these toolkits. We're going to talk about two things: suicide prevention toolkit, and then the youth gun safety toolkit. We'll do suicide prevention first and talk about just what we were seeing in some of the county data. And we know that gun suicide rates make up a large majority of our gun deaths. We also see that with our homicides, but 2/3 of those gun deaths of suicide in comparison to 1/3 of the gun violence to homicides. So this toolkit gives you resources, gives you availability to reach out and learn more about safe ways to store guns, mental health facilities that are available to help, because not only does suicide affect those close to the loved one, they affect the community in the neighborhood. So it's all about resources, and it's intended for anyone in the community at any age. The other thing that's really great about the toolkit is we wanted to make sure that everyone had access. So no matter what group you identify with, what language you speak, where, you know, the resources are in Spanish right now, and I know we had some conversations about making it available in other ways, but wanting to be able to connect to our younger community, to our LGBTQ plus, and anyone that feels like this is a resource for them. So access to prevention tools was really one of the key pieces here. If we can move to the next slide on the safety kit. I know it's a similar looking slide. So the second part we'll talk about is the youth gun safety. And so this is actually the next slide. I had them out of order in my head, but this goes back to two toolkits. So when we talk about our younger generation and, you know, what they look to as answers may not have been what some of us had looked to as answers in the past. And this is really about safety. We take a lot of time as leaders in the community, as parents, as caregivers. If you put a pool in your backyard, you put a fence around it because it's a safer way to make sure that there's not drownings. If you know you're allergic to bee stings, then maybe you carry an EpiPen with you because it provides a level of prevention and mitigation. And so really that's when we talk about the youth gun safety toolkit, some of those resources, that's the mentality that we really were looking for our young folks to have, is it's just another element to provide something that they have and something they can lean on. If there's anything we've learned about the last couple of years, it's that our mental health is extremely important. And we see way too many young people. I can speak very directly for the work we do, going on calls in the community. We are seeing way too many young people turning to guns as the answer for whatever their problems are. So this is a great toolkit. You know, on the screen, you see the suicide prevention toolkit. You can scan either of those. You see the youth gun safety toolkit. And again, it's an education and policy group, but we firmly believe that educating and empowering is such a strong tool in itself. There is a place for policy, and we will eventually have some of those things, you know, prepared and ready to go when policy is the time. But our goal is, you know, to prevent suicides, to prevent injuries, to prevent unintended injury or death, when we hope that everybody can find a resource for a better answer. So I'll move on to the next slide, which will be our next presenter. But those are the toolkits, and those will be a little bit that you'll learn about. I do want to say, when you get on the website, for anybody that will get on the website, and I'm sure Bella will put the link in, it is the smoothest maneuvering. It is a great website. It is so easily functioning and so user-friendly. Just really proud, Bella, of the work that really you led us through, and what it looks like now at this day, which I thought, you know, a year or two ago, gosh, are we ever going to be able to get something, because everyone is so busy. But it's a phenomenal website. So thanks for all the hard work on your end.
Yeah, and thank you so much for your leadership and sharing what our education and policy group has been working on since our last meeting in June. There's been quite a bit of progress since then. So absolutely, we'll put the links in the chat for the toolkits. And at this point, we're going to launch the second poll. We want these toolkits to be a helpful resource for you all, and we want them to be easy to share. So we want your input on that. And so the first question is, how do you see yourself using either of these two toolkits? And you can select the responses on your screen or add ideas into the chat. The second question is, how do you see yourself sharing either of the two toolkits? So sharing them out with friends, with family, with neighbors, and if you're a community leader, with your constituents and community members. And then third, what topic or topics would you like to see covered in future toolkits? This is an ongoing process. This is all building into our larger public awareness campaign. So we currently have two toolkits out, but we are going to continue to release these. And so we'd like to know what you would like to see in the future.
And Bella, you know, one thing just to add, because unfortunately I do see this in the world that I live in with fire and EMS and mental health, is taking that first step of just finding one resource to help one person that maybe said one thing that just didn't sit well with you. That's what I loved about how you put this toolkit together and how we all collaborated, is it just gave you one option that you could so easily and quietly do on whatever device is in your hand. And sometimes that's all it takes, is just, who would I call? I don't even know who to call. You know, what would be something that I could do to help this person? And I felt like that's how, excuse me, that's how simplistic and easy it was to hop on there and look at that toolkit. So hopefully others feel that way too.
Yeah, thank you for that. Absolutely. We'll give a little bit more time to finish up the poll. Or it might be down. Great. And we'll move to our second progress update. So Dr. Kelly Anderson is the coordinator of psychological services for Anne Arundel County Public Schools and a member on our environment work group. Dr. Anderson is going to share what our environment work group has been working on these past few months.
Thanks, Bella. So one of the major priority for the environment work group is really to support and coordinate crisis response protocols in the county. And what that really means is we really want to try to identify all of the partners that are involved following a gun violence incident, what their roles are, and what's the ongoing follow-up for victims and their families. And that's been part of the work that we've been doing since June, is identifying those partners. And really, when you look at what is the coordinated response system, we really want that to be about supporting victims of gun violence and interrupting cycles of community gun violence. So there's really sort of a three-part process to this. One of the first parts is really trying to prevent violence from occurring. And some of that is really by looking at things like risk mitigation protocols. For example, in our school district, we have a threat assessment policy and regulations, which means we have a process for identifying student threats and really evaluating the seriousness of the threats and kind of what interventions need to happen. So that would be a good example of a risk mitigation protocol. Then once we've had an incident, then we're going to really move into that second part of this circle, which is the immediate response, which would involve a variety of agencies, sort of that on the scene assessment, speaking with the community members, trying to have an immediate response that works in a preventing more violence fashion. And then, of course, we know that any incident of gun violence is not a short-term response. It really has a long-term impact. And so we want to be looking at ongoing follow-up. What does that involve and what community agencies are involved in that? It might be things like weekly check-ins, and sometimes it can even involve years of check-ins. And you can see that those groups that will be involved really in all parts of this cycle would be law enforcement, crisis intervention teams, and the Office of Emergency Management. And certainly for a larger incident, it's important to know that there are protocols for a larger incident, such as a mass shooting. So we shared a version of these maps out at your last community meeting, but another area of focus for the environment work group has been really looking at which communities are most impacted by gun violence and which types of gun violence. Because you can see that different areas of the county experience different kinds of gun violence. So this on the far left is firearm-related homicide rate. And that really shows us that North and West County and the city of Annapolis have the highest rates of gun-related homicides in the county in the past few years. Moving to the middle, the blue map, you can see that our gun-related suicides are more widespread. You see pockets in North, South, and West County. So you see some overlap between homicide and suicide, but you see a more widespread impact of gun-related suicides. And then lastly, on the right, you have the green, and that is really looking at gun-related assaults. And you can see that they're most concentrated in North and West County, but with also high rates in South County. So you can see there's overlap here, but there's also different pockets. And one of the things that's important then, and that's being talked about a lot, is the different types of gun violence and the different consequences for different neighborhoods. So when we look at these maps, we try to think about what are the successful approaches that we can bring to our county in order to reduce these forms of gun violence. And there's some good examples out there. For example, street outreach and community member training as violence interrupters can deter homicides. These programs can also reduce the number of adolescents involved in gun violence by providing job training, school support, and mentoring. So that's really an intervention attempt that's really looking at prevention and early intervention, trying to support communities and students to move away from gun violence. Another type of intervention would be hospital-based interventions, and they can also help victims of gun-related assaults or unintentional shootings by providing a recovery plan that connects them with community-based services, home visits, and follow-up assistance. So those are just a couple examples of some successful approaches that we could consider bringing and amplifying in Anne Arundel County. As for our next steps, the environment group is really looking to engage with the different communities where we're seeing the higher rates of gun violence and really try to think through what are the ways to hear from the community about your experiences, your challenges, and what you think would be good solutions to reduce these forms of gun violence. Because when you look at it from the outside, it often the solutions that you might think of are very different than what you might know to be true when you're living in that community. And so I think, especially given the diversity of our county, we want to make sure that we're truly understanding what's happening in the communities that the community members are experiencing, not just what it looks like from the outside. So that's really the goal of the environment group moving forward.
Great. Thanks so much, Dr. Anderson, for sharing those updates for our environment work group. As we consider how to best engage with you, the community, we would like your feedback. So a third poll should have popped up on your screen. And this one has 2 questions. So the first is, what community engagement approaches would you most likely respond to? So if you were to be contacted in one of the ways listed on your screen, which would you most likely respond to? And then the second question is, what would be barriers for you to get more involved? We understand that you have a lot of competing priorities and busy lives, so it helps to understand what are the biggest barriers to getting more involved in this sort of work for you all. We'll give some time for you to respond. And for those who are tuning in on Facebook Live, you are welcome to answer these questions live, to submit any other ideas that you have. We are open to any creative or out-of-the-box solutions. All right, as you are finishing that up, our third work group and third strategic priority that we presented to you, the community, in June was to release a data dashboard on gun violence topics. And we have since released that dashboard. And so I'm going to turn it over to the health officer to share the progress that we've made these last couple of months and to highlight what we're seeing in terms of local data trends and findings.
Thanks, Bella. So as I mentioned earlier, data is really important in terms of understanding what we are talking about. Kelly just gave us a really great snapshot to help us understand the different textures of what's going on, right? The difference between homicides and suicides and assaults, and that was over a 5-year period. Next slide, please. On our website, you'll find that, but you'll also find our dashboards, which shows some year-to-date data and helps break it down a little bit more granularly. This one is for suicide. It maps it out on where in the county we're seeing that, and it keeps it. It gives you a really good sense of where it's happening. But one of the things we always want to make sure that we have, we're respecting the privacy of people who are affected by this, and so it gives you a really good sense of where it's at, but doesn't kind of pinpoint it. But you can interact with this, look at which neighborhoods are being affected, and also get a month-by-month look at what's going on. Next slide. And then we have the same thing for our homicides as well. And we really think of this dashboard, this year-to-date, to give us some up-to-date information of what's going on in our communities compared to that historical look. Gives us a way to focus both on the short and the long-term trends that are happening here. As we are going along, we're continuing to refine and pull in more data sources. This is Bella has led this work. I think I will say this again towards the end, but all of the work that you see here today would not be possible without Bella. And she has been pulling together groups of people to really pull this data together, because this isn't something that we really collected with an eye towards reducing gun violence, right? And so as we talk about it, as we pull these data sets in, it'll inform how we collect data in the future as well. And over time, we'll be able to get a better and better picture of it. But I think already what we've been able to do is really show where different aspects of gun violence are manifesting themselves. And that gives us a really rich ability to be able to then say, how do we target our interventions? So I encourage you to check out our website. I encourage you to share your thoughts on what would be helpful. We're always sifting through ideas. We gotta plug through all of them, but that's how we're gonna grow the work that we're doing and really make an impact.
Thanks so much for sharing our data dashboards. And as the health officer noted, this is something that jurisdictions are experiencing across the country. Unfortunately, there's a severe underinvestment in gun violence data. So our understanding of the issue is severely limited. And so the progress that our county has made in this field is in some ways a model to other jurisdictions across the country, but also, of course, helps inform our local work. We also wanted to share what trends we're seeing compared to some national indicators to give us some additional context. So I'm going to be sharing how our county rates compare to some of the main objectives from Healthy People 2030. So we'll be taking a look at 4 indicators from Healthy People 2030, which is an initiative of the Department of Health and Human Services and the Office of Disease Prevention and Health Promotion that sets national objectives to improve community health and well-being over a 10-year period. So that's where the number 2030 comes in. We're going to be using a common method of comparison, which is a rate per 100,000 residents. That way we can more easily line up how Anne Arundel County is doing with our 500,000 residents compared to the millions of Americans in counties, in other counties across the country. And of course, we would expect our gun violence trends to look a little bit different here than in other places, even from Baltimore City to Calvert County, which both aren't too far away. However, these indicators, these national indicators, at least offer us a benchmark for how we're doing and what direction we want to see our gun injuries and deaths going, which is downwards, of course. So the first measure is the gun-related death rate. And so you can see at the top, our most recent national rate is 11.9 firearm-related deaths per 100,000 individuals. And then our national target is slightly lower than that. So in 10 years, we want to see that rate at 10.7 per 100,000. And then below that, you can see what our county rate is, and you can compare that to the national indicator. So our county rate is 7.6 per 100,000 residents, and this includes gun homicides, suicides, and other gun-related fatalities. So you can see that we are slightly below the national average, but we're not that far off. And we also want to aim for, and much like the national trends, we want to aim for decreasing that rate. The second indicator is reducing homicides. So this is for, you can see again at the top, the homicide rate, and this is for all homicides, gun-related and otherwise. The national rate is 6 per 100,000, and the target is slightly lower at 5.5. So that's where we want to be in 2030. And then you can see our county homicide rate is 4.2. And then just below that, you can see the homicide rate for gun-related homicides is 2.5. And I put on the right-hand side a graph that shows that. So of all homicides in Anne Arundel County, on average, the majority of those, or 60%, are gun-related. So again, we're seeing that our rates are slightly lower than the national average, but we're still, again, not that far off. And we want to see that rate continue to decline, especially knowing what proportion of our homicides are gun-related. Third is the suicide rate. And again, looking at the national rate is 13.9 suicides per 100,000. And again, this is all suicides, gun-related and otherwise. And the target is, again, to lower that slightly to 12.8. You can see for Anne Arundel County, our suicide rate is 12.1 per 100,000. And of that, 4.9 is the rate of gun-related suicides. So again, I pulled it out into a graph. So you can see that of all gun-related suicides in Anne Arundel County, 40% involve a gun or a firearm on average. And now that may seem small, especially compared to the 60% homicides, but that's actually the majority. That is the most, guns are the most common method used in suicides in Anne Arundel County. So that 40% is the majority. So again, we are a little bit closer here to the national average with our suicide death rate. And so we do want to see that decrease and work towards decreasing that, and especially the proportion of suicides that are gun related. And then fourth and finally, the last indicator that we're going to take a look at is non-fatal gun injuries. This is an area that doesn't often come to mind as much when folks think about gun violence. We even saw that at the beginning with our poll. That wasn't one of the top choices, wasn't even close, but injuries are a very prevalent and damaging form of gun violence. So for this indicator, you can see that the national rate is 26.3. And then the target is actually very ambitious, especially compared to some of the others we were looking at. As a nation, we want to cut that rate in half to 10.1 over the next 10 years. And then you look at our county rate and you see that we have quite a bit of work to do in this area. Our rate matches the national average. It may likely be even higher, since this number only includes victims who go to a hospital or an emergency department. It doesn't include those who don't, but are still injured. And then on the right side, you can see the most common reason why individuals are going to hospitals for treatment of a gun injury, which is accidental discharges for 53% of the time and assaults for 40% of the time. Nationally, this trend is actually reversed, with assaults making up the majority, and then accidental discharges being the second most common cause. So our county is actually slightly unique in that we have a high level of accidents and unintentional shootings that other counties tend not to. They tend not to have this trend. And the good news is there are steps we can take as a county to bring down our number of unintentional shootings through safe and secure storage and ensuring proper handling of guns. And a lot of that work is already underway through our educational campaigns and through the work that our work groups are doing. And it's important that we're taking steps towards reducing this form of gun violence because injuries can be severely damaging, at times causing lifelong physical and mental harm. And also all too often the victims of unintentional shootings are children and teens who access a gun that they shouldn't have and hurt themselves or someone else. So there is a lot of work to do here, but there's also a lot of room for opportunity and improvements that we've already started working towards. And so that wraps up our data, both our local data and giving you a chance to see our dashboard and then seeing where we're at compared to some national trends. We wanted to launch one last poll, more specifically about our data. So the first question is, what is your reaction to our county data? So did you find this surprising? Was it not surprising? Did you know all of those numbers? Did you find it interesting and want to learn more? The second question is, what would be a helpful reminder to visit and share our data dashboard? We understand that this might not be a tab that becomes one of your personal bookmarks, though we'd be happy if you did bookmark it. So what are ways in which we can remind you that the dashboard is here? We're updating it. It's available for you to view and to share and to use. And then the third question is moving us into our short Q&A section about this first portion of our community meeting, which is what questions do you have or still have about gun violence in Anne Arundel County? And you'll notice the poll gives you the option to say if you'd like to submit a question in the Q&A, reminds you that you can submit any questions to the Gun Violence Intervention Team email, or if you don't have any questions. And with that, we'll move over. We have time for just a couple questions before we move over into the Be Smart presentation. I do see that a question has come in. Someone asks, will you share all the information after the meeting's over? And if so, where can you find it? So we will absolutely share these slide decks and all of the links are active. And again, we'd encourage you to go to our Gun Violence Intervention Team site and to sign up for notifications. That also is where our dashboard is at. And then we have both toolkits have their own page. So all of those links are in the chat. I'm going to have to scroll up at this point, but all that information is available.
Bella, we have a hand raised. We have a Michael who has a question. Michael, you're allowed to ask your question now.
Looks like you might need to unmute yourself, but you should be able to. While we're waiting for Michael to unmute himself, are there any more questions, any more hands raised? Okay, so there's a question in the Q&A. Is the data available aggregated by race? And you might mean disaggregated, which is, so the health officer had noted that this is sort of the start. We're going to continue to dive into what variables and measures we have available. And that is one of the key variables that we want to include. So we're actually in the process of developing what will likely be a second, more in-depth dashboard that will give that data disaggregated by race, sex, and age for each of the gun violence types and incident types that we're seeing. Great question.